Well, welcome everyone. Thanks so much for joining us today. Thrilled to see lots of familiar faces on the line joining us again for our latest conversation about SDOH screening, my favorite topic, and maybe favorite topic of many of you on the line as well. We'll go ahead and jump in. I have a handful of slides today to talk about. I have a tool that I'm hoping will help you all with data collection that I want to share at the beginning of today's call. So I'll spend a little bit of time talking about that. And then also want to spend time at the end of this session or the second half of the conversation, starting to think and talk about how to actually use that data. But throughout today's conversation, if you have questions or suggestions at any point, please don't hesitate to jump in, and there will be points where I'll ask folks to share as well. So as always, you can put responses in the chat, or you can either raise your hand and I can let you know to come off mute and speak, or just go ahead and come off mute. It's a smaller group today, so we shouldn't have too much trouble talking over one another. I'm Natalie Graves. For those of you who haven't attended one of these sessions before, I'm the Director of Research and Implementation at Convergence Health, and spend a lot of my time thinking about and talking with hospitals and providers all across the country about social drivers of health screening specifically, and how to get geared up for the CMS requirements that are coming forth shortly, but also much beyond that. How do we think about SDOH screening as just the entry point into a conversation about how do we really understand the holistic needs that our patients and communities have? And then what can we do about that as clinicians in hospitals, or leaders in hospitals, or people in other parts of the healthcare ecosystem? So a couple of goals for today. I already spoke to this a little bit, but I'll start off by doing a little bit of a show and tell on a Convergence, a tool that we developed. It's really just a pretty simple data template that outlines the CMS screening measures specifically. So many of you may know that the CMS system will be opening up for that optional data submission for those SDOH screening measures in the next couple of weeks here. And so I wanted to take a minute to share this tool with you all in case it's useful to help you get organized for that data submission process. Then we'll talk a little bit about, now that we've collected all of this information, I know many of you have spent the last year, 18 months or more, thinking about how to stand up your screening process. Now that we actually have a number of data points, how can we use that information to look holistically at patterns that we might see among our patients and in our communities? And then importantly, we're going to talk at the end about the data is ultimately just a starting point from my point of view. You know, it tells us where to look or where to go next, but in a lot of ways, it just opens up a whole new set of questions. So we'll talk about the questions that the data might open up, and then how we can go forth partnering with those across our teams within our organizations, but also with patients and families and folks in the community to actually do some meaningful work or take some meaningful action. So I want to start off with a poll. I'm going to launch this. Could you just let me know, is your organization planning to submit the CMS SDOH screening measures this spring? So just a quick yes, no, or maybe you're not sure. And as a reminder, those two metrics open up for optional screening this year. So they'll be mandatory beginning in next year, so reporting on calendar year 2024. But this year they'll be available for optional reporting. So I'll give everyone another couple seconds, and then I will share the results. So I've got a couple trickling in. All right, so here we go, share results. Looks like a pretty even split. So some of you are planning to submit this spring, which is excellent. Some of you are not, also excellent. And then a number of you are not sure. Okay, so that's good to know about an even split. And then I have one more question for those of you who are planning to submit, or maybe those of you who aren't as well. if you are planning to submit the health equity measures, where are you in the process of preparing? So do you have the data ready to go and put in the system as soon as it opens? Do you have some idea of how you'll pull that information, but maybe haven't actually gone through the motions yet? Or have you not yet started preparing? Give this one another few seconds as well. All right. Great. So similar spread here. Some of you have the data ready to go. So if you have lessons learned or tips to share today, we would welcome those. A lot of you have an idea about how you'll pull the information, but maybe haven't gone through the process yet. Great. And then some have not started. Okay, excellent. Thank you for sharing that. It gives us a sense of who's really jumped off the deep end to start to think about this. And lots of us are in the planning phases still. All righty. So let me go ahead and just talk about that tool that's available, and I'll drop the link to this in the chat at the end of the session, and I'll send it around an email too. This is on our Convergence Health website. You can download the tool for free, and please share the link with anyone else you know who might find it useful as well. Our goal is to share this as widely as possible. So what it does is, as I mentioned, pretty simply outlines the measure specifications so that you can really figure out, well, what numbers do I actually have to report to meet these CMS requirements? And it has a number of tabs. This is one of the first tabs that has the SDOH1 measure. And so what that is the rate of screening. So the numerator is the total number of patients screened for those 5 domains of SDOH, and the denominator is your total patients over 18 years old admitted in the last year. So on this template, I also included the hyperlinks to any measure specs or FAQ documents that CMS has released. Those can sometimes be tricky to track down, so they're all in one place in this tool, and it has some of that important detail around reporting period. The second tab in the tool is related to the second SDOH measure, so SDOH 2. And this is the screen positive rate for each of those 5 different types of health-related social needs. So even though it's one measure, SDOH 2, it's actually reported as 5 different rates. And so what this does, again, is really simply lays out the numerator and denominator for each of those rates. So you can go through one by one and see what information you would have to pull from wherever you have this stored in your EHR or maybe some other system, and just pop those numbers right in here, and then ideally just port those over to the CMS system when it opens. Now, the other thing that this tool does is this is the third tab in here is related to the other CMS health equity measure, which is the hospital commitment to health equity measure. So this is actually just a structural measure. And this one is required for reporting beginning this year when the system opens. So this is it's a 5 component structural question. So for each of these elements, your hospital has to respond yes or no. Do you have these practices in place? And the idea behind this measure is CMS wants to get an understanding of to what extent do hospitals have these kind of foundational elements or systems or processes in place that will help work towards health equity for patient populations. So this template includes the exact language that's in the measure specs. A lot of this will be up to interpretation in your organization, right? And if folks have questions or want to ask each other about that, we can spend some time doing that. But this one, again, really simply, you go through and read the definitions in each of those domains, and then either attest that, yes, we have this in place, or no, our facility doesn't have this in place yet. I'm going to pause on that overview of the template and what's included for each of those measures, and see if anyone has questions or if anyone has used this and found it useful, or maybe has suggestions for tweaks we could make. Any questions?
Yes, this is Susie Gaylor with Blount Memorial Hospital in Tennessee. I just wanted to, for the group, ask if my understanding is the same as everyone else's for the hospital commitment to health equity, that yes, we are required to report, but as far as the performance of, how we report the points possible, at this point, there's no penalty if it is not, for a certain score. Is that correct?
That is my understanding, yes.
Okay, thank you.
Yeah, that's a great question. Any other questions? Okay. So the other element of this tool that might be useful is we included in this first iteration one kind of sample chart or graph that you could use in your QI efforts. So what this does, if you put in your screening rates for, so let's say by month, if you put your screening data into this table that has the months across the top in orange, it will populate a graph like the one below that shows you your screening rate. And each of these bars has the blue is the numerator, so the number of patients who screen positive, or the number of patients screened. The orange is your denominator, so your total number of patients who are eligible in that month. And then the gray line is the percent of patients screened. So that auto calculates. So what this can be useful for is driving some of your improvement efforts, right? You can use this information to say, what percent of patients are we screening? Did we have a month where maybe we didn't screen as many for some reason? Or maybe there's a month where you instituted a new process or a new approach and you see either a spike, hopefully, in your screening, or maybe you see no change. So pretty simple tool, but if you can just pop your numbers in here, it will auto-populate this for you so you can bring it to your teams and use it in your improvement efforts. So this is what we're hoping can be a starting point to build out additional tools or templates like this to build on the screening work, beyond just tracking the measures themselves. And so again, would love to get feedback from the group. Is something like this helpful? Are there other questions or things that would be helpful, templates that would be helpful to build out that would help you answer questions? Or other ideas you have for how we can add to this to help with your improvement efforts around your screening processes. Thanks, Bettina. Well, you can think about it if there are things you wish you could easily see, or you say, gosh, I wish I could have a visual of what percent of my patients screen positive across all of the different domains. Put it in the chat, or send it to me an email at any time. We're eager to keep tweaking this and adjusting it to make it useful for you as the work evolves. And then finally, again, I'll share these slides. This is a kind of a helpful table, kind of a cheat sheet of all of the different hyperlinks to the measure specs, the deadlines, the who's required to submit which measures in each period. So it could be helpful to have on your desk as you're getting into reporting to know where to find all of those details. All right. Any final questions on that data collection tool? And Joshua, I see your question or your suggestion about something for SDOH2 as well. Excellent. We can work on that. All righty. So then we'll transition to the next portion of the conversation, which is now that you've spent all this time setting up the processes to gather this information from patients, have these conversations, and hopefully connect people with resources in the moment. Now that we have this rich set of data in our systems, be it in your EHR or elsewhere, we have a new opportunity, right? We have a new question of, well, now what can we do with that information? What does it tell us? How can it help us think differently about maybe the programs or services we have within our organization? How can it help us think differently about the partnerships we might want to form with others in our community? And so we'll talk a little bit now about some initial steps you can take in thinking about how to use that data. So here are 4 domains you can start with to think about what to do with that information. And the first is to think about the completeness of the data. So that's very much related to that graph that I just showed a couple slides back of, yes, you might be screening patients and starting your screening processes, but how many patients are you screening? Now, you don't have to screen all patients. There's no requirement for that. But as you can imagine, the more complete your data is, the better picture you're going to have of any patterns that might emerge overall. And so one of the first things you can do is use that tool to look really simply at what % of patients are we screening? And then you can ask questions like, are we targeting certain groups intentionally? For example, maybe you're intentionally prioritizing your resources to screen patients who have certain conditions or who have multiple chronic conditions, or maybe patients who are readmitted are a priority for having these screening conversations. And so that might kind of skew your results, right? You have an unrepresentative sample. You might also find that there are groups of patients who you are missing in the screening process. And in fact, maybe some of the patients who have the highest levels of need or who might be the most difficult to have these kinds of conversations with are actually not represented in your screening. So just thinking about as you're ramping up and looking at the completeness of your data, are there groups that are overrepresented or underrepresented? To make sure as you're thinking about what the data show, you don't have blind spots, or you can minimize those blind spots. Second piece to consider is how accurate are these screening data? And this is something that we talk about and we hear about a lot, that oftentimes the teams who are doing the screenings or having these conversations are wondering, well, how can I be sure that patients are really sharing their full situation with me, or are really letting me know all of the needs that they have? And we've talked a lot about this in the sessions we've had on how to stand up the screening processes and thinking about who's asking the questions, when are you asking the questions, where are you asking the questions, how are you having these conversations in a way that really promotes trust? Because if you can have that trusting relationship, you're going to get more and more accurate information, right? Which better enables you to support those patients. So this is one that's a little bit tough to measure how accurate your data is, right? But you can start to think about it with that lens. So maybe in your community you have a lot of challenges around housing, but you're not seeing that show up in your data necessarily. So you can ask questions like, well, is it that we're not seeing those patients, or is it that we're not having the environment where people are feeling comfortable sharing that with us for any number of reasons? And start to just kind of poke holes again in your assumptions and what you're seeing in the data, and think about whether it's really giving you a full picture. Then the third thing you can do is start to think about patterns, right? If you step back and look at all of your data over a given year, you can say things like, well, where do we have the relatively greatest number of need? Maybe there's one of those 5 different domains that you're screening on that really jumps out as a high area of need and is something you want to focus on. And so then what you can do once you get a sense of, hey, maybe we want to focus on food insecurity, then what we're going to talk about is, well, how do you go from looking at that data as a starting point that tells you what to focus on to getting to really understanding what's driving those needs, and the specifics and the nuances around those needs and how people are experiencing that, so that you can design a solution that actually solves the challenges, and so that you're not designing some action or taking action blindly that won't actually meet the need. So here's the example of how to look at completeness. Again, you can use that template in the, or that graph in the template, or you may have other ways that you're able to calculate your screening rates. And here's an example of what looking for patterns might look like. So you may be able to look at your screening data. You might be able to pull that out of your EHR, or you might be using some other tool to collect that information. Or you might also be able to look at your Z code data. So these have a lot of overlap, but they're not exactly the same. This example uses Z code data just as an example. But I just want to note you could do this either directly with your screening data or with something like your Z code data. So this is just an example. It's made up data. And what you can see really clearly here is that there are two areas that jump out as highest areas of need. So if I'm, looking at this data as someone in a hospital who's wanting to understand what needs exist in our community, the economic problems and the unemployment really stand out as areas to focus. So this tells me, okay, what else can I learn more about these areas and what's going on? So with your Z code data, you can actually drill down farther. So what this slide is, again, fictional data is the housing and economic problems domain drilled down into the subcategories that make up that overall larger category. And so again, you can see here, there are areas that jump out. So the types of economic and housing problems that these fictional patients are reporting are extreme poverty, low income, or homelessness unspecified. So that gives you a little more information, but still not really enough to know how exactly to take action. So it points you in a direction and then opens up a whole new set of questions. And so what I'm curious to hear from the group is, are any of you looking at your data in this way? Are there any patterns that are jumping out or things you've learned? And when you look at something like this, what kind of questions does it raise? Or where would you go next? What types of questions would you ask next to get to some sort of action? Anyone willing to share their thoughts?
So, hi, this is Jatana Fulbright from Covenant Health in Tennessee. We've been collecting the social determinants of health data for about the last 2 years, with a big push last year to increase our screening. And we do exactly how you described. We are able to drill down. We have a 9-hospital system. Each building, we're able to drill down to their collection of each Z code that we look at the larger buckets, housing, food insecurity, et cetera. And then we can drill down to the specific Z code. But what we're seeing is that every community seems to have a different pattern of need, depending on where they're located. We have some more rural setting facilities, and then some cities that are more metro. So depending on where they're at, we definitely do see different needs across our service area. And we're kind of moving into the phase of our plan or our strategies around how do we then impact those needs if there are lack of resources in a community. What groups do we need to get in front of? Community partnerships do we need to start forming to try to meet the needs of our patient population?
Thanks for sharing. That's great. And a really important point about how you can see that variation across the different communities. So really useful to drill down. Is anyone else looking at their data have any reflections to share? Okay. So as a segue, I'm going to share a story unrelated to healthcare. which will make sense when I get to the next section. So I have a son in kindergarten, and so I'm just entering the world of standardized testing. And so he had some standardized tests at the beginning of the year. And I was talking with one of my friends who's a teacher, kind of in a tizzy about why are we doing all these tests, and tell me about this and how do you use it? And she said, I'm going to tell you a story about these tests and how I talk with parents about them, because many of them have the same questions as you. I, every year, have a student, let's say it's a little boy, who is doing great in class, is from my assessment as the teacher is totally at kindergarten level, learning, knows all of the letters and sounds and shapes or whatever they're focusing on. But when they get their first score from this test, the parents always call me panicked, because their son, has scores that are much lower than they would expect, given that all of these other indicators, all of their other experience has been that their little boy is, right on par with his classmates. But this data is showing them otherwise. And it comes in a fancy report, and it tells you percentiles, and it tells you what to do about it, and it's very official. And she says, what I say to those parents is, does your son use a computer at home? Does he spend a lot of time, does he know how to use a mouse or a trackpad or kind of interact with the computer system? And oftentimes the parents say, no, not really. And so she says, don't worry about it. The issue likely is not that your son is struggling with math or reading. It's that he just doesn't know how to do the test because he doesn't know how to use the computer. And so what I take from this is, before we start to panic and work with fancy tutors or start to have these rigorous programs to help my son improve his math skills, maybe we need to step back and have that conversation with the teacher on, well, what is the actual driver here? And maybe it's just spending a little time with the computer. And so what I learned from that for myself as a parent was to not panic. But also in this work, I think it is so illustrative of the fact that we don't want to guess at what the underlying issue is, right? We don't want to guess wrong and invest all of our resources and time on trying to solve a piece of the problem that doesn't exist. That's not really the driver. And so the best way that we can do that, the best way that we can understand what is really the underlying factors or the potential solutions for whatever we're trying to solve, is to talk with the people who are experiencing it and the people who know. And so this is a graphic that our team has worked on with our partners at PFCC Partners, who many of you probably know, that really illustrates how we want to go about doing this work. And the data is our starting point, right? The data tells us what the challenge might be. In my story, the data told me as a parent the scores from my child. But then I had to have a conversation with the teacher, and ideally with my son as well, about, well, what's going on here? Can you tell me a little bit more about what the experience of this test was like? What teacher, based on your experience, do you think might be going on? And so this is where we start to talk with our patients, their family members, the clinicians, the folks on our team who are seeing what's going on every day, and then people in the community too, who have a better understanding of what are all the forces and factors around these huge buckets that show up as simple bars, in our data on, well, yes, we might have a lot of food insecurity, but working with all of those people together, we can really understand why. And then together we can better figure out how to fix that challenge or address that challenge, right? We can go together and focus on a solution that's really going to address the need, instead of just trying to do something probably, with our best intentions, but might totally miss the mark if we don't really understand what we're trying to address. I think we have some of our patient and family partners on the line who we work with on the HQuick and on other projects. So I want to just pause and see if they want to add anything to this idea of working together with patients and families to develop the solution. Okay, if you are having trouble getting off mute, just interrupt me at any time. I'll keep going. This is another, so thinking about getting to action and starting to figure out how we can address these needs, both at the individual and community level. This is another really helpful framework that I go back to a lot that you might want to bring to your team or think about yourself. So we often think about, okay, I'm going to screen for these 5 different needs: housing, transportation, utilities, and then I have to have a solution, right? Ideally, I have to have an organization to connect someone to, or a resource to connect someone to. Ideally, it's a one-to-one solution. And that can be helpful, right? If we have a list that we can connect people to of resources, that can be great. But it's also often the case that those resources don't exist, or even if they do exist, they might not exactly meet the need. And so this is just a different way of thinking about the multitude of ways that you might be able to address these social needs, or even just to start thinking differently about how you provide medical or healthcare services in a way that's more accommodating given those circumstances. So awareness is about just doing that screening, getting that understanding of what's going on. Adjustment is things like, how can you reshape the way you work based on patients' needs or circumstances. So Libby from PFCC Partners has a great story about this, where she worked with an organization who realized that a number of their patients were late or were missing their appointments because of transportation needs. And they talked with people and talked with the local transportation or bus service, and realized that the bus line stopped quite a far distance away from the clinic. So what they were able to do is actually partner with the public bus to move the stop closer to the clinic. And what that did is it helped people get there and get close and be able to keep their appointments on time. So that's an example of the clinic didn't really have to do anything differently, but moving that systemic factor so that it could more easily connect patients with the services made all the difference. Assistance is what we often think about. So how can we link people to resources that might exist in the community? And alignment is what I think about in terms of, Jatana, what you mentioned, like who are the partners in our community who are already doing this work? How can we be a resource to them? Maybe it's as a financial resource, maybe it's as a technical assistance resource, maybe it's just as a partner to make sure we're more intentionally referring patients to that resource that's available. And then advocacy is another way that your organization or other, hospitals, other anchor organizations in the community, institutions in the community, can also have a role in addressing some of those underlying factors that influence all of these health outcomes. So what I take away from this is, holy moly, there's a lot that we might want or have to do. And there's also so many different ways that we can go about it. And so it just kind of opens us up to think creatively about solutions, and that they might not always be a one-to-one match. But if there are things we can change systemically, that will make all the difference. All right, so let's open it up for questions, reactions, stories. I saw Lou, thank you for putting a question in about staff education. We get that question a lot. Anyone willing to share about the education they're doing with their staff around their SDOH work? Lou, I do have some, I have some examples from other webinars I've had with some states, with some hospitals in Montana and Idaho specifically. I have some great examples of key messages people are using, strategies in terms of like meeting one-on-one versus meeting in staff meetings. So I can share that around as follow-up to this meeting. That might be useful. Any other questions for me, for the group? Can be unrelated to what we've talked about today. Anything any questions, other questions related to SDOH screening? Well, let me tell you.
Oh,
Yes, go ahead, Lindsay.
yeah, this is Lindsay. Thank you. I was just going to go back to, the why behind the data. And I know patient family engagement and community engagement might be new to some of the hospital participants on. So just wanted to offer, ourselves as a resource. If you're new to having discussions, to really finding that why behind your data, we have a lot of experience in a whole community of patients and family caregivers who are eager and excited to share their knowledge, their unique experiences, and their new ideas around topics like this. So just wanted to offer that as a form of support for any hospitals who are interested in having that conversation to dive a little bit deeper into your data.
Thanks, Lindsay. So that is actually, I'll talk a little bit now about what we have coming up next and what we're working on to support the SDOH work moving forward. So our next webinar in April is going to be all about patient and family partnership, patient and family engagement, and SDOH. So we'll talk about everything from working with patient and family partners in the screening process in terms of, how do you set up the process in a way that builds that trust so that you can get that best, most accurate, most reflective data. And then all the way through what Lindsay just mentioned, how do you go from looking at an area of need in your community and really partnering to address that need and the different strategies and specific ways you can do that. So we'll have both some examples from organizations that are doing this and a lot of perspectives and input and co-presentation from our patient family partners as well. I will be sending the registration link around for this soon. I will include it in the follow-up email for this, and then stay tuned on our listserv as well. And if you have patients and families that you're working with in your organization, maybe you have a PFAC, Patient Family Advisory Council, maybe you have volunteers or community health workers or others who you're working with around patient and family engagement, invite them to this session. We would love to have those voices and perspectives on the line as well, because a lot of this work is really about bringing those different experiences and skill sets together. And so we can start to do that by talking about it, but more importantly, by actually doing it. So please feel free to invite your patient and family partners as well, or anyone in your organization or community who might be interested. The other opportunity I have for this group is actually exactly about what you asked about, Lou. And one of the things we're working on is creating a tip sheet with some messaging and scripting around how to talk with your team about SDOH screening and how to talk with your patients about it. So we've heard that this is a challenge for folks. And I think it's also something that really needs to be customized and come from the specific why behind what you're doing. So in some organizations, you may be really focused on this with a population health lens. In others, you may want to talk about this as a way that you're thinking about advancing equity or working to improve care for certain patient populations. And so what this tip sheet will do is give you a framework, some examples, and some ways of thinking about how to craft that message so that it resonates with your team and then also with patients when you're talking about the screening. So I would love to get input from folks who are doing this and have experiences and lessons learned. So if you're willing to share what you're doing around talking with your team, talking with your patients around why you're doing the screening, please, I'll also send this link in the chat and in the follow-up email, but please consider signing up for a slot and sharing what you're doing. And we'll share that tip sheet out with the group later this spring. And then finally, I have one more poll to close us out to get a better sense of what else would be useful over the coming months. So let me share this. These are just a few ideas of what else we could do. But if you have other ideas or needs, please put those in the chat as well. So a couple other questions. I think you can answer. I think you can select more than one. What else would be helpful? Webinars with hospital stories. So maybe some more traditional webinars where we have folks sharing what they're doing, how they're setting up their screening processes. A workshop on developing your educational resources and scripts. So similar to what I mentioned in terms of that tip sheet, but actually a live session to work through doing that. Storming sessions we held a lot of these last year. So those are those really open-ended sessions where we can just come and talk in a safe space about what is frustrating, what is working, what do you have to share, what do you need more support with? And that helps us know where to prioritize our efforts. Webinars on things like building community partnerships or thinking about how to take action, and then one-on-one or small group coaching, or anything else if you want to put it in the chat. The poll only allows for one choice. Okay, thank you, Patrice. So if many of these things seem useful, maybe put that in the chat as well. Thank you. We'll give it another couple seconds. Okay, so we have a clear winner, which is great. We can put this top of the list. Looks like workshop and additional resources on the educational resources and scripting for the team would be useful, followed by the webinar with hospital stories. Excellent. All right, well, thank you so much. Watch for a follow-up email. I'm actually going to, before you leave, put a couple of those couple of those resources in the chat. So here is the data template. And then let me grab the focus group sign up as well. All right. Any final questions or topics anyone wants to discuss? I'll stay on for a little longer. Otherwise, thanks so much for joining for this short and sweet session. And don't hesitate to reach out if you have other questions about the data collection template or other ideas for events. Thanks so much, everyone.